Welcome to the Let's Get Comfy podcast. And yes, we're in Orlando, Florida at the Florida Healthcare 2025 Annual Conference and Trade Show. And I have some wonderful, magnificent guests with us today from CHE Behavioral Health Services. Thank you, ladies, for joining us on the platform. But as tradition, one thing I always do, I always let the guests introduce themselves. I always say healthcare workers and professionals don't like talking much about themselves. But I'm going to let you kick it off.
All right. I'm Dr. Phyllis Kennedy Howell. I am the National Clinical Director of Psychiatry. I am a nurse practitioner, and I have my doctorate degree.
All right. Yes, ma'am.
And I'm Heidi Rogers. I'm the Regional Director of Operations. I oversee Florida and Tennessee.
All right. Thank you. Thank you both for joining the platform. Give you a round of applause for joining us.
Thank you.
Thank you for giving me the opportunity.
Thank you for having us.
Yes,
Thank
ma'am.
you.
Yes, ma'am. So, 60-second pitch. Dr. Howell on CHE, its origins, and who do you serve?
All right. So CHE has been in business for 31 years. So we serve the psychiatry and psychology population for mental health in skilled nursing facilities. So we particularly look for things like CMS guidelines, gradual dose reductions, compliance, quality measures, all of those things that will help our residents have a much better mental health outcome and make sure that they have the things that they need when it comes to their mental health there in the skilled nursing world.
Okay, so what's your role with CHE?
So I am the National Clinical Director of Psychiatry.
Okay.
I oversee the nurse practitioners that go into the facilities.
All right.
And I also take care of any of our education and compliance stuff that happens to do with psychiatry.
All right. That's a wonderful introduction to CHE and yourself. Ms. Rogers, tell us who you are, ma'am, and your role with CHE Behavioral Health Services as well.
So I'm the Regional Director of Operations. And what that looks like for Florida and Tennessee, we have several buildings, and I'm responsible for making sure that we have the right fit for providers, making sure that even having that relationship with facilities so that we are making sure that they have the right in-services, the right groups, and every facility needs to be tailored differently. And as a regional director, I need to know my facilities up and down the coast to make sure that I'm partnering them with the right providers, services, and even making sure that we provide them with the right care in terms of clinical operations as well.
Okay, so your role as Regional Director of Operations and your role as clinical leader, how do you guys collaborate to ensure better patient outcomes?
Okay. So for Heidi and I, we collaborate in a way from the clinical lens and clinical standpoint. I used to be an operator, so I used to be a regional director for Georgia.
Okay.
And so I'm able to guide Heidi in some direction in operations. But my main role is to help her, guide her in the right directions in facilities with her clinicians that she has there to support them and to support the roles that they have with the facilities. As Heidi mentioned, we do in-services. So I do a lot of those in-services to help the facility staff understand the mental health care of patients and how that reflects those residents as they are going through the different changes in their life.
Okay, that's amazing. All right. From a stigma standpoint, of course, mental health is a big topic today, as it should be, but also behavior health as well. What are some stigmas associated with mental health conditions, you'd say?
So I often hear, especially with my background as an occupational therapist, from that demographic, they're always saying, there's a stigma behind losing their independence, not wanting to get crazy and not being able to advocate on behalf of themselves. And that's the beauty of psychotherapy, is that not only do we give them that outlet to be able to talk about feelings, we also give them the strategies to be able to deal with those things, but also our in-services with our staff and the facility lets them see trigger points and signs in those residents so that we can come together and have a holistic approach.
I love that. What are some early signs you think you can identify for, let's say, a skilled nurse facility, a new admit comes into the facility, may not have the, history, right? What are some early signs of mental health conditions that a loved one can monitor, whether a patient is in skilled nursing or at home receiving care?
So I always like to say it's changes, whether it's a change in their environment, change in mental status, physical status, even changes in seasons. Because then when you're in the holidays are always going to bring out those red flags. So you should be perked up to notice, like, okay, as soon as a person moves into a new facility, there should be a baseline drawn right then and there, because that's a really big change in their life. So that's one of those tricky points that you're going to see. And anytime you're having that having us come in and do those assessments, it gives you that baseline. So if you're starting to see those changes, we can always go back to the beginning and let you know where they're starting and where they are now and how we can impact them with therapy.
That's
Absolutely.
wonderful. Good, good. So, Dr. Howell, I want to ask you. Um, my pastor said something before. He said he believes that 70% of mental health or behavioral health issues stem from childhood trauma or experiences. What's your thoughts on that topic?
Absolutely. Everything that happens to you in your childhood can always rear its head in your adulthood and really in between those childhood and adulthood. But when you become a senior, those things come back to you because you have memories. And sometimes that's all you have is memories. So you go back and you look at those traumas and you kind of think about them. And all you have is time at this point. When you're in your senior years, you're thinking about all the things I could have done or all the things I didn't do or all the things that happened to me. So the one thing I can say about CHE is that I love the fact that we look at those things. We look at the trauma that they went through in their childhood, in their adulthood, and then we look for ways to help them not be re-traumatized in their senior years.
Wow, wow. So from an onboarding standpoint, if you're onboarding a new facility, have a new partner, what's sort of your process that sort of make it a seamless, streamline all the processes in regards to onboarding, but make it seamless for the facility as well?
So we do our very best to make sure that we are meeting the things that they need in their facilities. So we come in and we educate them on our processes, but we also understand what the processes are for the facilities, what their regulations are, and what those things that they need for us to meet those regulations. Our compliance department and our programs here at CHE, we are very much in tune with what CMS regulations are. So we know what the facilities are looking for, and we have compliance and quality that also helps us with those things. We have a huge quality department that helps us with compliance and making sure that we're doing the right things so that the facilities will be doing the right things.
All right. So, Ms. Rogers, do you guys only partner with just facilities, skilled nursing facilities, or is it ALFs? You tell.
We do. So we actually work with quite a few skilled nursing facilities, rehab facilities, and assisted living facilities as well. And we actually work with an organization called PACE, where they have adult day
with PACE. Yes.
It's really nice that we're able to go in there to their adult day programs and be able to even give that component of outpatient therapy as well. So the family knows that we're in there, and we give the family an opportunity to partner with us as well in there.
That's really good.
The other part of that too is we have an outpatient program. So we have psychiatry and psychology for outpatients. So maybe the family member's going through a really hard time putting their loved one in a nursing home. That's a very difficult decision for people to make.
Yes.
So sometimes they may need that mental health care, and we do provide that on our outpatient program.
That's really good. I love the fact you guys do outpatient for sure. I think with evolutionary healthcare, that's one thing, a growing area for us. We look at things holistic as well, but you go into these facilities, a lot of times they want you to follow the patient once they discharge back home. So that's something that we're growing and we're going to be providing here soon as well. So this platform is all about knowledge and resources. What knowledge and resources for the everyday person you guys can share today? Just give us, let's say 2.
All right. So knowledge would be understanding your own mental health, understanding where you are with your mental health, and knowing that it's okay to get help when you need help. And it's okay to be strong when you need to be strong.
There you go. I love that. That's really good. One for you, Ms. Rogers?
So I'm going to come from the different standpoint. I think it's important as a person on the outside, if you're going to be a mental health advocate, make sure that you're always keeping it to be client-centered. Make sure you're hearing them, especially in the facilities. Everyone wants to go in and give their own template, and director of nursing wants to do it this way.
That's true.
Nobody's taking into account what the patient needs and wants. And that's the biggest part about psychotherapy is that we are client-centered at the base of it.
Absolutely.
Awesome.
Person-centered care.
Great answer. I'll say that. I'm sold. I'm sold. So theme song, CHE, what would be your theme song? Either one of you can respond to that for the organization as a whole.
So it was so funny. When we saw that question, we posted to our group and we all came on Lean On Me. Because
Lean on me.
Yeah, like, because not only do we want the residents and the family to lean on us, but we also need the facility to lean on us.
I love that.
Play a huge role in like making sure that their state audit goes well. So
Yes.
lean on us, trusting that our professionals are high quality providers
Mhm.
and that you lay that in our lap and lean on us and we got it.
Yeah. And then when you get done having to lean on us, we want to give you the tools where you can be successful and lean on yourself a little bit.
I love it. I love it. So, last final question. All right, Dr. Howell, you're a Georgia Bulldog fan.
I
I'm a
am.
Florida State Seminole.
Yeah, I am.
So you tell me, what's your expectations on the season this year?
National championship, baby.
National
Yeah,
championship.
go Dogs, right?
Go Dogs. Go Dogs. All right.
Yeah.
Well, go Noles, actually.
Go Gators.
Go Gators.
Yeah. Oh, man.
Yeah.
Go Rattlers, too.
Yeah.
Well, shout out my all. So thank you all for joining the platform. If
Yes,
you
sir.
will, let the audience know where they can find you, your website, all the information to share as well. And any final message to the audience as well.
Absolutely. I just want to say that my final message for you all is take care of your mental health. Make sure that you talk about it. It's okay. It's not one of these things that if you talk about it, it's a bad thing. I want you to make sure that you're asking for help when you need help. And then the way that you can get us, we have a website. It's www.cheservices.com. And we're ready to help, and we're ready to make sure these facilities have what they need and that they have the successful mental health that they, need for their residents and the care that they deserve.
Well, yes, ma'am. Any final message for you as well?
I do. So I always like to say, there's a lot of psych groups out there, and I don't know if you could go wrong with any of them, but I know how you can go right in the CAG. We've been in the business for 31 years.
You selling now.
Listen, our Chief Director of Compliance and Quality Assurance, she started off as a provider, and she's been here for 18 years. And so we're not creating new ideas. We are building the blueprint that we've already had for 31 years. So that's why you come to a trusted provider that have been across the nation with services. And we are built on providing good, compliant care, not just numbers and coming in your building.
Listen, I'll tell you what, y'all have me sold. Thank you for joining us. I'm so grateful you joined the platform.
Thank you.
Thank you. A special shout out to our sponsor, Evolutionary Healthcare, CMC Media, Let's Get Comfy Podcast, CHE Behavioral Health Services. Check us out.
Thank you.
Thank you.
All right. Y'all killed that.
Thank you.
Wow, y'all killed. Thank you so much. I appreciate it.
Yes, sir.
Yes, ma'am. Y'all killed it.
Take your show.
This episode of Let's Get Comfy was brought to you by Evolutionary Healthcare. Caring is what we do.